All right, most of us who work in offices, if you work outside in the blazing sun, if you're a construction worker, a bamboo scaffolder, a lot of us who work in air-conditioned, controlled climates look at them and say, God, I don't know how they do it. Well, some of them might look at us and think, oh, those poor caged animals don't know how they do it. Most of us who work sit in chairs for hours, sometimes without getting up or moving for 4, 5, 6, 8 hours. Oh my God, had a stretch. Doesn't sound strenuous, but it does give you a lot of aches and pains because of the lack of mobility. Computer neck, I just showed you that. Can I make the sound? Back pains, even headaches, tension headaches. That's where our next guest has helped a lot of people. Chris Watts is the co-founder of Stretch Limited, which specializes in a form of therapy called AIS, Active Isolated Stretching, voted one of the most valuable health gurus a couple years ago by the London Evening Standard. Also happens to be the only certified instructor of this form of stretching in Asia. Chris, good to see you.
Good to see you again. Yeah.
I was looking at your biography. You're 51 years old, aren't you?
Yeah.
Look at you.
Still going strong.
Fit as a fiddle.
Always trying.
What is AIS in a nutshell for the uninitiated?
Active isolated stretching. Well, basically, it's a sort of thinking out of the box, really, because most people think about the muscle they're trying to stretch, but actually here we get people to get involved with the muscle they're actually contracting. So you're contracting a muscle to release the opposite one. So it's the other way around. So we get people very actively involved in the contraction of the opposite muscle they're stretching.
So when those of us, who get what we think is lumbago or, lower back pains, just this nagging, kind of chronic whatever, as a result of sitting in an unnatural position for way too long a time, and we go to a Thai masseuse or therapist and they jump on our back and they start, digging their heels in and everything starts cracking, that may not be the first order of business.
Well, to me, everything is it comes back to alignment. It's very, very important to make sure that you're sort of symmetrical between left and right. You've got 29 muscles on either side of the hips, and they need to work in sync. If they're not, you're going to get torques, you're going to get rotation, you're going to get tilts. So, with that, it's going to be it's going to cause a lot of problems through the kinetic chain.
Is AIS a niche thing, or has it gained in popularity? Is it always going to be a specialized kind of form of therapy for a small group of people?
I think anybody can learn it. Anybody can apply it. It's just a technique, and I believe that it's something that, well, certainly there's over 200 Olympic athletes in the States using it, and I think it's just gradually creeping in there. Change is a dirty word. People don't like to change their methods of stretching, so there's a lot of people out there doing lots of static stretching. Ours is very active and dynamic.
Yeah. You know that old saying, no pain, no gain. You know that one, right?
I do.
Is that idiocy, or does that hold true? Does that all these generations? Is there a grain of truth to it?
I back off when there's pain. I think pain is a great sign, a great signal that something's wrong. Your body is screaming out, saying, "Hold on, back off," that sort of thing. So you got to be careful when you come across pain. It could be neurological. It could be compression problems. You got to be, just work with the client. Everyone's different.
Tell me some story. We're going to look at here's some pictures of you at work on one of your many clients in your clinic here, right in Central. Are you popping and cracking joints like an osteopath, or not necessarily?
No, it's very slow, subtle, gradual movements. And here I'm stretching the sort of calves. It's all very gentle work. And you're holding your stretches for maybe 2 seconds, so that connective tissue, which surrounds, it's like a sheath that surrounds all the muscles and joints. You want that to open up. Muscles are easy to stretch. I don't really worry about muscles. It's the joints. The range of motion is determined by the joints.
There must be a reason that some of the some of the most high-profile people are clients of yours here in Hong Kong. There must be a reason for that, because the results must speak for themselves. Can you tell us maybe a story, no names, please, at this point, about perhaps somebody who had some pretty chronic disabilities or limited range of motion, who was essentially cured by this very safe and gentle kind of procedure? Well,
I had a gentleman that came in 6 months prior to him having a hip replacement, and fortunately, this is coming from the States. His doctor basically said, look, if I were you, I would get as much mobility, as much flexibility into these tissues, because when we go in there and we start cutting the heads off the femur and stuff, you're going to get a lot of contraction, you're going to get a lot of scar tissue. So start with your flexibility work now, and then build up so that when you actually start the rehabilitation rehabilitation work is going to be that much easier. And he's been working with me to maintain his flexibility.
Is this, this is not a replacement for orthopedic treatment in the case of like hip dysplasia or anything like that, is it? It's more of an adjunct treatment?
It is. It's very functional. It's about making people move better, and it's about making people feel better within themselves. And people always ask me what's the greatest benefit, and I always say it's circulation. You know, it's improving oxygenation of the tissues, and it's removing all that rubbish, those metabolites out the system, which can actually cause a lot of cramping, a lot of stiffness in the tissues.
So this will show up in your renal results and your biliary results and your hepatic results too when you do blood tests after a certain length of treatment of this. I mean, you're eliminating a lot of the toxic side effects.
Precisely. And I mean, when you think in terms of how stiff people are in the joints, particularly the hip joints, because we're standing and we're sitting on them all day long, I mean, how poor the circulation is going into those tissues. And the more you can get those areas flushed out, because that's what the body wants, and it's the best healing, you're getting the blood and oxygen.
You know, I always wondered, because there's a strong gravitational pull that the Earth has on our bodies, and we spend most of our time upright with our heads up here and our feet down there. I remember like 20 years ago, there were these inversion devices, and they said, oh, turn your body upside down, get the blood to your head, and it's going to rebalance you and recalibrate you. And I can't find one now.
They are popular, actually. My mum has one. She's 81 years old. She has one in her garage in Florida. But basically, in essence, I think those units, as long as you don't have too much dysfunction in your spine, I think those units are great because it's just anti-gravity. You know, just moving into the opposite directions that you're going in.
Okay. What's the cost of treatment? Is it only for the very select and super rich, or is it, quite affordable?
It's $950 an hour, which is quite expensive for a lot of people, but it depends how much you value. The results are very strong.
Right.
Very
and it's not like I'm hurting, so I need to go to Chris. I mean, you do teach people, and you make you pound it in and ingrain it that these are things they can take away and use themselves, right? They take away skills with them, right? Is that correct?
Well, that's exactly right. I mean, let's face it, you know, you can't do craniosacral work on yourself, and you can't massage yourself, but you can stretch yourself.
Correct.
So that's what I do. I teach people how to stretch themselves.
Okay.
It's empowerment.
I'm ready to pay you a visit and get stretched, and I hope that, you know, my mom always said, stretch before you exercise. I said, nah, I don't need it, and I think I'm paying for it now. I'm going to get help from you next week, okay?